Good afternoon, sir.
Good afternoon. How are you?
Fine, sir. Thank you.
So, yeah.
ఇందులో పీడిఎఫ్ చేయడము చాలా కష్టమైంది సార్ నాకు.
Okay, speak in English.
ఓకే.
Yes, now coming to the point. Okay. No problem. Whatever, if you have any problem, you can let me know. I will help you. No worries. I will definitely help you. What to do, how to do, everything. Yeah, but the PDF is very good now. It looks pretty and it's very neat. Okay, fine. So you are writing to, okay, there's a problem here, right? So comma before no space, after comma space. Okay, Travis run. Okay, so this is Travis Ren. Okay, first line should be Travis Ren. So Travis Ren should go up. First line. This is the first line. The next one, he is a general practitioner. This is the second line. Second line. But it should come reverse. It should come in a reverse order. First this one. Okay, this is
Okay,
number
sir.
1. This is number 1 actually. And this is number 2. Okay. You have to follow that order. Next, Punt Road Medical Clinic. Punt Road Medical Clinic. So you missed there. It is 172 Punt Road. There are 2 mistakes in this. P capital letter and road is missing. So 2 mistakes in this. How can you do 2 mistakes in one line? 172 Punt Road. This is how you have to write. Punt Road Medical Clinic. Where is that medical? Punt Medical Clinic. Okay, here. Sorry. Punt Road Medical Clinic. Okay, road is missing here. Road is missing here. Then P capital letters. P is capital letter, not small letter. It is capital letter. Okay. 172 Punt Road. Mosman 2088. Mosman 2088. Fine. Otherwise, everything is correct. Next, 17th January 2016 is the date of admission and date of discharge. Okay, dear doctor. So you don't know the name of the person. Dear doctor. So here it will be yours faithfully. Very good. Yours faithfully. Why are you leaving this much space here? Let us start from here. Let us start from here. See,
Okay.
everywhere you wrote very nicely. See, here it went inside. Okay. See here, why inside, outside? You have to be very careful there.
Initially, I started like that. Later, I remember your words, sir. Again, I started writing from corner.
Okay, okay. Registered nurse. So you are a registered nurse. Okay, and you are working in the medical ward. You are working in the medical ward. Medical ward is missing here. Medical ward. Many people are not writing. It's okay, that is not our problem. Many people are not passing either. Okay. So here you have to write medical ward. Medical ward, St. Vincent's Hospital. St. Vincent's Hospital. 390 Victoria Street. Okay, St. Vincent's Hospital. 390 Victoria Street. Darling West. So very good. That's fine. Okay. Darling West. Okay.
Sir, one doubt, sir.
Yes, please.
Actually, they didn't mention either registered nurse or head nurse, not mentioned. I simply wrote a registered nurse there.
Okay.
We
So-
can follow like that only, no, sir?
Let us see here. I will show you. Miss Cassandra Kinser is a patient in the medical ward in which you work. So, right? So definitely that is a nurse. Okay. Definitely you're a nurse there. Okay. So based on that one, you are writing. Okay, that's okay. You're in the ward because you are a registered nurse, or you can be a ward nurse. No problem. Registered nurse is better. Fine, you have done a good job. No doubt regarding that. So yours faithfully. Okay, fine. Everything is fine. Otherwise, next coming to the point. Regarding Miss Cassandra Kinser, aged 32. Okay. Miss Cassandra Kinser. Be careful of the second S. Okay. You're writing three different S's. See here, this is S is different, this is different, and this is different. Okay, and this S, two S's, both are different. Write clearly. Either write cursive writing or write separate letters, whichever you want. If you want to join, join all the letters. If you don't want to join, leave all the letters. Separate,
Okay, sir.
like that.
Okay.
See, SSU joined, it's a confusion because we don't understand what it is. Miss Kinser has been diagnosed. Miss Kinser, do you have the notes? Correct it.
Yes, sir, I'm
Kinser
marking.
was diagnosed, okay, same day, right? Okay,
Same day admitted, same day discharged.
yeah. So, same day diagnosis. Okay, let us see. Admission diagnosis, okay. Okay, diagnosis, lip laceration and urinary tract infection. Okay, fine. So that's fine. So Miss Kinser has been diagnosed. Okay, or you can also say was diagnosed because it's morning. Okay, admission now discharge. So no problem. So Miss Kinser has been diagnosed with urinary tract infection and lip laceration. Okay, here you can write comma and here comma. Put a comma here and put a comma here and remove she and put here who. Sorry, put here who. Miss Kinser, who has been diagnosed with urinary tract infection and lip laceration, comma, comma, requires further medical evaluation. Okay. Write a referral letter to Miss Kinser's general practitioner. Appointment made at sexual health clinic. Okay. Follow up with GP. Monitor. Okay. Discharge home, good condition. Follow up with GP. And you are writing to Miss Kinser's general practitioner. Okay. Right. Follow up with GP. Okay, fine. Okay. Requires further medical evaluation. What do you mean by that, further medical evaluation? So that means you already made some medical evaluation or what? And you are a nurse, you cannot make medical evaluation. You can say requires medical evaluation, means nothing further, because everything is needed. Requires medical evaluation, you can say, not further. Further means what? Earlier something is done, something more is to be done. That is the meaning of further. There is nothing called further. Follow up. Okay, follow up. Follow up means assessment requires evaluation and appropriate management. Requires okay, requires evaluation, medical evaluation and appropriate management. Follow up. Appropriate management. So okay. So but here this is a referral letter. So what you can do is you have to bring the word referred. Yeah, this is correct, but the word referred is very important because this is a referral letter. So you have to say is being referred. Lip laceration is being referred for. So remove requires. That is correct only, but refer word should be there. So that's why we are changing the style.
Okay.
Is being referred for medical evaluation and appropriate management. Okay. Following the discharge today. Following the discharge today. Is that clear?
Yes, sir.
Following the discharge today. So after discharge, she needs all these things. Follow up with GP. Right. Next one. So that's clear. Today, admitted with the complaints. Who admitted? Who was admitted or who admitted? Upon admission today. Upon admission today. Today, upon admission. Today, upon admission. No need of writing. If you don't want to write, very good. That's fine. Upon admission today. Today, upon admission. Comma. Today, comma, upon admission, comma. Remove all these things. Lip laceration, abdominal pain, and burning with urination. Burning sensation while urinating or burning with urination. What is burning with urination? Burning with urination, I did not understand. Burning while urinating or burning while during urination. So with this confusing little, burning sensation during urination. So write whatever you want to write. For the last several days. For the last several days. For the last several days. For the last few days. For the last several days. Have been reported. Passive voice. Have been very good. It's a very good style. Have been reported. All these things have been reported during admission. Okay. She is sexually active. Avoid she. Avoid personal pronouns. Avoid personal pronouns. Okay. Okay. Sexual activeness. Okay. Or being sexually active. Being sexually active. So you can write she is remove. Okay. Being sexually active. Okay. Being sexually active. And neglecting protection. Neglecting protective measures. Neglecting protective measures and neglecting protective measures have been informed. These two things have been informed. Full stop. Have been informed. Okay. Neglecting protective measures have been informed. Avoid personal pronouns. Okay, have been informed. Okay. Questionable diagnosis is sexually transmitted disease. Okay. Questionable diagnosis. Who diagnosed? Okay, you can check it there. So, diagnosis. So, may have STD. So, possibility of sexual transmitted disease. Okay. There is a possibility of sexually transmitted disease. May have sexual. Okay. So, signs and symptoms suggest. Okay, you cannot do that one because you are not a doctor. So, admission diagnosis. Okay. Admission diagnosis in the hospital. Okay, GP diagnosed maybe. Right? So admission diagnosis may have. So signs and possibility. So preliminary diagnosis or possibility of ST, okay, has been observed, noticed, okay, or signs and symptoms suggest the possibility. Signs and symptoms suggest the possibility of sexually transmitted disease. I'm not sure how you have done this one, but you can say signs and symptoms, okay, or preliminary diagnosis. Okay, so already, yeah, a doctor has diagnosed this one. Yes, yes. So you can use the word further here. Definitely you can use. So no problem. Remove further. Refer for further medical evaluation and appropriate management following the discharge. Yes, doctor has diagnosed. So no problem. You cannot diagnose. This is a hospital. Fine. That's good. So that's fine. Absolutely fine. Then next one. Possibility of sexually transmitted disease. Possibility of sexually transmitted disease. Okay. Possibility of sexually transmitted disease cannot be ignored. Possibility of sexually transmitted disease cannot be ignored. Okay. Right. There's a possibility of sexually transmitted disease. Okay, cannot be ignored. Passive voice. Okay. Physical examination is nil significant. Physical examination is nil significant. Physical examination is unremarkable. Is that what you wanted to say? Yes, Vijaya Lakshmi, is that what you wanted to say?
Yes, sir.
Unremarkable, use the word, not insignificant. But
Okay, sir.
background sounds. Close it, mic. Be in the safe zone. Physical examination. Physical examination has been unremarkable. Okay. Physical examination has been unremarkable. Okay. Right. Next one. During the hospital stay. So you can write during the hospital stay. Remove all these things and just say hospitalization. During hospitalization, one word. hospitalization. During hospitalization, comma. Cipro 500 mg twice daily orally for 6 days and clindamycin 300 mg 4 times daily for 10 days were commenced, have been commenced, past tense, during hospitalization, okay, recently. So you can say better have been commenced, okay. This you can talk as present tense, have been commenced, better. This is also okay, but have been is better.
Okay.
Additionally, see everywhere you are writing past tense, prescribed, have been prescribed. Okay, you can use like that. Additionally, Peridex mouthwash, 10 ml swish and spit recommended after meals and before bed. Okay, before bed. Along with, what is this? No space here. Along with oxycodone, 1 orally every 4 hours for lip laceration, prescribed. No, along with means no need prescribed. Okay, so along with means no need prescribed. Along with this, so that means this is also recommended. Otherwise, we can say prescribed. If you want to write, then full stop, put a full stop. Okay, put a full stop, remove along with. Okay, oxycodone 1 orally every 4 hours for lip aspiration. Okay, has been prescribed. Has been prescribed. So if you want to use the word prescribed, then don't use along with. Along with means along with that this is used. No, then again, why are you using another verb? Otherwise, remove along with and put the verb has been prescribed. She is She is ready to discharge. What is this? She is ready to discharge. She is ready to
Ready,
be
sir.
discharged. She is ready for discharge. She is ready for discharge. Okay, you're writing. She is being discharged today. Already we have written here in the beginning. Following the discharge today. So why you want to write here again? Actually, this should go there. So there is no need of this one. First of all, this is mistake. And it is already there. Okay. It is already there. With the scheduled appointment at sexual health clinic. An appointment at the sexual health clinic
Has been scheduled.
scheduled. An appointment at the sexual health clinic has been scheduled. Okay, right. And okay, here. Appointment made at sexual health clinic. Okay. Okay. An appointment at sexual health clinic has been made. So at the sexual health clinic has been scheduled. Very good. This is the sentence you can use. In view of the above circumstances, it would be highly beneficial. Avoid this monotonous sentence. Don't write sentence. This is everyone writing this sentence. It has become a cliche. It has become a cliche. Okay, I don't know why everyone is writing this sentence. In view of the above circumstances, it would be highly beneficial. So no problem. In view of the above circumstances, if you all these things. So remove all these things. So it would be highly beneficial. Remove. It would be okay. If you all these things you remove, and you can write like this. Okay, how you can write? In view of the above circumstances, okay, and directly go to the verb providing, make it a gerund, providing medical evaluation. There you wrote evaluation or assessment. Evaluation, same thing, don't write. Medical assessment, a definitive diagnosis, you can say. Medical assessment. Okay, in view of the above circumstance, providing medical assessment, and where did this go now? And okay, and appropriate follow-up action, our management plan, follow-up action would be profoundly beneficial for Miss Kinser. Okay, Miss Kinser. Full stop. You can take like that. Okay. So word count is less. You have to write at least 1, 2, 3, 4, 5 lines here. Then you have to write. This address should come here. So till here, at least 5, 6 lines you should write. Word count is very less.
Okay, sir. I thought to write medical history and social history, but as they are asking the patient's GP, no, so it is a known case to the GP. So I thought
So
not
you are
to
not
write
writing to the GP. Okay, you are writing to the GP. That is different thing. But you are writing to the GP. That's you are following it up. Okay. So after this. Okay.
Here also Miss Kinsen's GP like that they are
General
mentioning.
practitioner Travis Wen at Control. Okay, you are writing to the general practitioner GP. Okay, and you made an appointment here, everything, and you are writing him. Okay, so he already knows. Yeah, he already knows. No need to write. Okay, this only you can expand a little more. Okay, anyhow, I'm going to correct many letters. I'll give you the other sentences also. So you can write whichever is relevant only you can write. Yeah, because it is to a GP, fine.
That too
So you
clearly
need
they
not
are
write
mentioned,
that
write a referral letter to Miss Kinser's GP like that they are asking. So I thought not
So
to write.
admission date, actually this Cassandra Kinser. So this is the hospital, and from the hospital you are writing to the GP. Correct?
Yes, sir. Yes, sir.
So he knows already all these things. Okay.
Okay, sir.
Right. Discharged home, good condition. Discharged back home. So we have to write here one more letter, one more word. Discharged back home today. Okay, following the discharge, back home today. See, we missed that one. Okay.
Okay, sir.
So is that clear? Was the session beneficial for you? Did you understand majority of the points which I explained? Okay, fine. Can you hear me?
Hello, sir.
Okay, did you get all the points clarified?
Yes, sir.
Okay, okay, fine, fine.
Okay, sir.
Okay, then bye.
Sir, one doubt, sir.
Yes, please
Actually,
ask.
I used to follow in each and every paragraph. Previously, I got some instructions like to have to mention first address the second name of the patient. So I used to mention actually in every paragraph. Now, as your correction of the previous.
No, that is okay. If you write also okay. If you don't write, if you are writing in active voice, then name of the patient is required. If you are writing in passive voice, name of the patient is not required.
Okay. Even if I
Okay.
mention also, no problem, no, sir.
No problem if you mention also, no problem if you don't mention also, no problem. But the sentences should be correct and it should be meaning. They should be meaningful. Okay.
Okay. Okay.